work in the setting that I'm in, I said, first of all, in order for me to have respect for my peers, and then also respect for the people that come into the community of treatment, the patient that needs help, I have to be prepared to understand that I have a cultural way of seeing things. And just because you see it one way, just because you perceive it one way, doesn't mean that it's that way. There are other ways of looking at things, and being culturally competent is an intentional process, especially if we have never broadened our lens. Broaden our lens, meaning expand our horizon to get to actually know people and or to get to explore what they see and how they see it. This is my definition of culture. I wrote this definition of culture when I was in my bachelor's program, and I kind of broke it down. Culture is a unique factor of our human development that drives us all through life. Culture is a tool of the mind. It's an individual's way of seeing and interacting in the world. It encompasses one, value systems, beliefs, and perception of the world around them, race, socioeconomic class, gender, sexual orientation, ability, geographic location, age, religion, and language all impact the formation of culture. The way in which an individual is socialized within their family and the community around them, races, class, religion, and language, will impact the formation of their values and beliefs, which then become their culture. Culture is fluid. It's wherever we are, where our culture is working with us. It is not a static entity, which one takes out of a box on occasion. It is usually with us daily. The manifestations of our culture are seen in the ways we carry out our daily activity. For example, a daily activity can be anything from washing a dish to eating a particular food or having specific styles of activities of communication. The ways in which we approach and implement our daily activities will demonstrate our cultural upbringing. Culture is an internal process that is formulated and within and through the interactions in many facets which impact our lives. The manifestation of culture happens externally within our daily activity. This means that all of us have a culture, and we're continuously living in the moment of our culture, what they call our tool of the mind. Now, this is Peterson's model. First of all, based on what I said, because anybody understand how powerful culture is just in your view? And give me a reason why it's powerful. And it is powerful.
But it's been reared childhood, like from birth. I mean, we grew up in it. I mean, so it's been instilled in us our entire lives.
What else? I mean, that's very important. That's right, because it's actually how we've been able to, we've socialized, we've learned how we think. Because thinking, how we create thinking, we can get thinking in many ways. We learn through what we see, we learn through what we read, we learn through what we hear. We learn and we interpret the world in very unique ways. What else?
What comes to my mind is, as far as working with people that come to us for assistance, depending on my cultural beliefs, whether they're healthy or unhealthy, will determine my success at being helpful with that patient.
Right. Exactly.
If I have a preconceived notion of who they are, I'm already saying they ain't gonna make it, or possibly. I don't have that issue, but I'm just saying if that stood in the way, because when I first started working in this field, Asians live by secrecy and keeping it in the house, and they don't want to talk. So if I was living by that, I would not even try to pry to get them to talk.
Right. The whole idea of motivational interviewing and even interacting with the patient, meeting them where there is an ideal here that if I'm going to respect that patient, for example, we have 5 patients downstairs right now. Can anybody see the cultural impact downstairs?
Absolutely.
Yes.
Just give me one factor that you see at play. Age, so there's some demographic, there's some age.
Gender, race,
Respect.
Environment.
We have a person down there who actually lives on an authentic Indian reservation. And inside, in the reality, there's some indigenous, which means there's some things common to them that they do in their culture. And if I was to, as a practitioner or somebody who's practices a counseling and or therapy, if I really am showing integrity in what I'm doing, I may want to learn, even if it's just to Google it, to get a little bit of understanding what's indigenous to that culture and how is that indigenous value that this person is bringing to the table either going to help me understand them so that I can put in interventions that have more empathy also, as opposed to them feeling judged and exposed to some of my own culture that's clashing with theirs. Another example, me and my wife, we're two different cultural backgrounds. What's up? Her family, my family. I'll show you something very simple in a culture. When we wash dishes, we put them away. When Lily grew up, when they wash dishes, they put them on the drain board. That was a culture clash me and her had for many years. Came to an agreement. When we have company, let's put the dishes away. When we don't have company and we're just getting down at home like we do every day, clean them, put them on the drain board. I've learned to surrender to that. Don't come out here. I learned to surrender to that. And I stepped back and realized it ain't that serious for me. But that's how, it can be as simple as that. Culture clashes happen every day. As a matter of fact, culture clashes are a major disruption in the communication patterns that sometimes come in to the family system, where one man marries the woman and they're bringing in their culture, and because they're not intentional to understand each other, there's clashes going on and we're personalizing it. You can do that right here in interaction with your own peers. You can do that with the patients.
Yeah,
And be a cook and a chef.
I was clashing with him last week. We was in there having a session, and instead of just saying you got a minute or knocking on the door, you just barge right in. That affects me when I'm talking to a client. So I brought it to his attention, and I think we worked with that.
Being culturally competent is responsible. It's what Dave talked about. Being a highly effective person understands that the world doesn't revolve around them. That in order for me to be effective in the world, I have to understand other people, whether I like it or not, because I'm not here by myself. In the corporate world and in the dealing with patients, it's important for us to know that. So culture is typically described as a totality of learned behaviors of people that emerges from their interpersonal interaction. So coming from a kid on up, Uncle Bob, Joe, Aunt Mary, babysitter, every single one of them were involved in the formation, if you will. That's just a description of let's say, my culture. I do have an Uncle Bob. I did have a babysitter. I did have an Aunt Tina. Each one of them had an impact, be it subtle, be it covert, meaning simply powerful or just something subtle in my daily interaction with them. Me as a human being and you as a human being will internalize what you see, what you hear, what's being said. And how you internalize that starts to form, it helps you formulate your cultural ideology. Then you have the macro systems. You have the systems bigger than the family, the neighborhood. There's something, for example, I lived on Haines Street. There were some things about Haines Street. Haines Street was a gang. Haines Street was Haines Street, and you didn't go to Brickyard. You didn't go to Dogtown. These were other neighborhoods around us. You stayed within the boundaries because the culture told us that we were in danger, and we were. Culture includes the ideals, values, and assumptions about life that are widely shared and that guide specific behavior. There's two aspects of culture. Objective. There's the visible artifacts, food, clothing, meaning that things that don't come outside, don't come in me. Then there's a subjective. This is the dangerous part of not being culturally competent, because it's invisible. The values, attitudes, norms based on the individual's perception. That's the dangerous piece about not being culturally competent. Because if I'm trying to, let's say, give therapy, or if I'm trying to give counseling, or if I'm even trying to interact with my peers, I have to remember that I bring a subjectivity to the table. The way I think and what I think about in social connection to you will always play a factor in how I engage the relationship with you. If I'm not looking, as Dave says, to be intentional to build teamwork, that means I will be the type of person, let's say if I have to do some clinical stuff, I'm not going to consider that if my culture or the way I've been grown to be a procrastinator, or let's say I'm somebody that's just lazy in nature, and I don't want to respect the fact that the system that I'm in calls for a job to be done. So no matter what my ideology is or what my personality is, the system will either expose me. So for example, if I'm lazy and I don't want to do the work, but the system calls for scrutiny, for the work to be observed and supervised and checked, the work will expose you. It will expose that part of your personality. My culture has to accept the fact that there's people in here who have different values. But there's a system in place here too. And the system will expose your values, or your value will enhance the system. Anybody know what I mean by that? If you have a value that's not intentional to check your work, or you don't have that value, it doesn't make you a bad person. You just simply you didn't learn to follow through on things in your life. But let's say the state of California Department of Healthcare says, I don't care what your value was, what you learned. We have some outcomes that we want done, have to be done, and need to be done if you want to be licensed in this particular area. What do you think is going to happen?
We have to have it done.
We got to have it done, but what, if the system does that, what do you think it'll do for the person who maybe have morals and values and say, well, you know, I'll take the passive approach. I don't really care.
It won't succeed.
Yeah, that won't succeed in either.
But the persons who have to make sure the system is scrutinized, like myself or David, will look like the bad guys.
Right.
And why would we look like the bad guys? We're not the bad guys. We're actually the good guys trying to live out the value or the mission, if you will, of the state giving us the license, because they have a mission too. If they license us, we have to now live in the mission. The mission will give you your license if you live out the mission.
Intentionally.
Intentionally. Which means that we're not asking you how you feel about this. If you want a license to treat people and help people to overcome not only their addictions, but to live more productively, these are the parameters in which you have to work in. We hope that you have the values and the integrity to do the job so that you can pass on something that's of value, because we're helpers, not hurt.
To honor your word.
To honor your word.
Integrity.
Each one of you understand, being an employee, you really are making sort of a contract with the universe, if you will, that I'm going to help some people. Now, if I disrupt your work because I don't do my work, right, am I helping? There is a direct and an indirect impact on patient care. So you have to ask yourself, personality-wise and culturally-wise, how do you view the world? Can you keep up with the pace of the mission at hand? It doesn't ask you if you feel like it. The mission at hand says this is what we have to do. So if the system that I'm working in and I am responsible to keep it working says that I need to check to make sure that it's living up to, it's easy for me to look like the bad guy. Being culturally competent it encompasses so many factors. It also makes me, if I'm going to be competent, I have to check myself. I have to realize that, wait a minute, is it him or is it me? Did I really do the work? Or is he riding me and looking at me through a microscope? Truthfully speaking, if the work is being done efficaciously and with intentionality, not to be perfect, we're not talking about perfection. We're just talking about with a little integrity. The microscope doesn't, see, it looks like it's a microscope, but if something keeps coming up, either somebody's practicing tolerance or maybe not even being a leader at all because I'm just allowing it to go through.
An example, what we would call internal conflict. On a subculture, if I'm coming from a place of circling the drain, the hustle, right? What we call the game.
Right.
What really in essence is being less than honest.
Right.
What we see is the value that I may operate in that subculture is when you owe me something, I want my full issue. But when I owe you, I want to give less than due. So when I bring that into the workplace, this contract that Dr. Keith alluded to, the contract is I'm making an agreement for this hourly pay. I will put in these amount of hours of work. But if my mindset is I want full measure when I'm to receive, and I want to give less than due when I have to give. So it's all about shortchanging. Can anybody relate to shortchanging? Right? We want full measure and we don't want to give up anything. That could be coming from a subculture. So I'm just kind of using that analogy to talk about cultural differences.
And that's one implication of culture. Now let's look at the integrity factor and how my culture may impact the primary purpose while I'm here. What's the primary reason we're here? Anybody know? Help the patient. Let's question that. Am I intentionally looking at each patient with the intention to understand them? Or am I taking the lazy approach? Let me just get this over with. Let me get the group. Am I trying to understand them? Am I asking them open-ended questions about themselves so they can describe to me their perspectives and their subjectivity, if you will, of how they see the world and are interpreting things? And can I do that when I hear something that doesn't line up with what I think ought to be and should be? Because we lose the patient, we lose the effectiveness, and we lose the principle of benefits. Anybody know what that means? That's doing what's in the best interest of the patient. If we don't put our cultural glasses on, if you will, to look through their lens and understand that there may be things about them, even the drug and alcohol counselor who's kind of put himself through treatment. He's got there, he's worked the 12-step program, he becomes now the guru, or he's sold out for it. But then somebody he's trying to counsel or she's trying to counsel doesn't see it that way. Can I still keep my vigor, my passion, my love? Or does my nonverbal and verbal expressions don't agree or accept your way of seeing it because, I think I know it and I think I got it? It's ineffective. Being culturally competent also means that we simply have to understand that we don't understand how everybody sees the world. It also means that we have to understand that somebody's going to see me differently, and I might really see them differently, and I have to work through that myself so that I can be more effective for that person. It's the same thing interacting with staff. We have to respect that I don't care how many of us are in the room, that there are individual, powerful, subjective ways of seeing the world that we all have. Okay? Just look at your relationships at home, even with your own children or your spouses, boyfriend, girlfriends, whatever floats your boat. I promise you, most often, the communication piece is usually garbled with what I think it should be and how it should be, not because that person's wrong or right, but because maybe my culture has a lot to do with how I believe it should be. And because there's no meeting of the minds, if you will, there's always going to be friction and confusion. That's where communication is powerful. Powerful. This isn't just for here for Dedicato. If you guys lock in on what you're learning right now, I believe it will change your paradigm about society and whole. It will help you to go outside and see somebody who don't look like you, see somebody who doesn't think like you, and not make the idea in your mind that they actually act like they look. People form a community and interact with each other. This can be formed around specific identities, geographic beliefs, and daily practice. Dominant groups set the parameters, have the greatest influence. Come on, guys, we got to keep it real here. What's the dominant group in this country?
Okay.
All right, are dominant in what way?
Control the aspects of the society.
Just look at privilege and affluence and opportunity. That's just real, right? We're people, right? We can handle this, right? That's just the truth. And what else? So you got American versus African American. Then you might even have a culture where there's a Latino. They have the Southern Mexicans and the Northern. I don't know what that means. Mexico's Mexico to me, but that's also again a culture right out. But you understand the subcultures? Go ahead.
One of the things that we know as well, from my experience over the last 20 years in this field, one of the biggest gaps in behavioral health in general, it's not so much by ethnicity. It becomes an issue by region. I can have a client come in from the East Coast. Their posture, their communication is more assertive.
Even their shoes. Black men and Philadelphia tend to polish their shoes all the time. I'm not saying men and other races don't do it.
And in California, it's a lot different. I could very easily misinterpret their cultural reference as being aggressive and having an attitude.
That's funny you say that. When I first came out here from New York, I thought it was very difficult because I thought everybody else out here thought they was better than me
From where?
from back east.
You said New York though.
Yeah.
And then when we look at, say, the South, if someone comes from the South, we may have a preconceived idea about the slunch, about the slow movement. We may even interpret that they have no motivation
Even the way they talk.
by cultural bias, right? And they may look at us, being that our humor isn't the same as the Midwest, the South, or the East Coast. Our humor may not always fly very well, and we'll interpret that as they're being antisocial.
You know, I don't know who's paying attention to this, but this is extremely essential when working with patients and they're struggling with one another. When you can understand cultural diversities, it helps to get them to see differently or be willing to be more empathetic to the other person.
Okay, so let's look in context and where we are. Okay, the dominant group here. Would probably be the leadership here, right? And when we say dominant, because they have the most influence, doesn't make us it simply makes us in this parameter. So the dominant group usually has influence over the subordinate group. The subordinate is simply, if I'm me being in a position of leadership, what would be important for me to understand cultural competence? One, just because I've been given an opportunity to be in a position of leadership gives me no right to abuse that position, if you will, of influence and power. As a matter of fact, the more I learn to serve, the more I learn to apologize for who I can't be at certain times, the more I learn to take responsibility, the more I am actually being culturally competent to know that just because I'm in a position of leadership or own the facility still gives me no right, as you are, let's say, in the role of a subordinate here, to treat you with any value less than who you are. Cultural competence means that for me in this context is one, that I owe the patients my attention. And I do that by questioning some of you as being parts of the leadership, because you're all leaders. How are you engaging and interacting with them? And what is your experience? And how are you conceptualizing what's happening with them for their best interest? But at the same time, me or David and even Charles and Bob, I have to also interact with you from not being dominant, but from an area of supervision. And my supervision, if you're not being culturally competent, or just in the culture of Dedicato, or even in the culture of the corporate structure that you are employees, and you are all being paid to do a job, although you may be in the subordinate role, it makes you no less than. And if you can understand that I'm always looking at you through the eye and lens of responsibility, I don't walk around here with the CEO tag. I know who I am, but I do walk around with the responsibility to make sure that I can expect what I inspect. And not always the greatest at it, because I'm being pulled like an octopus. So I'm looking for leaders. You may be in the culture of Dedicato in a subordinate role, but in effect, you're still a leader in the role you're in, because you have direct connection to the primary reason we're here. And that is for the best interest of the patient. Can you hit the stop there for a second?